first and foremost, thank you, everybody, for coming out or staying after the workout and, listen to what I have to say. I want this to be a fluid conversation, so feel free to stop me at any time, ask me any questions. Hopefully with dentistry, it's the one thing I know better than Google. So, the only thing, but when it comes down to it, I should absolutely have the answer for you. Today, what I want to talk about is, can improving your oral health help you live longer? Before I dive into the topic, I want to give you a little bit of history in terms of, how I ended up in Greeley, a little bit of backstory on me. So I took over the practice for Dr. Richard Boys 7 years ago, right in this complex, right over here. So yeah, me and Rich, what was interesting, I found out he had 13 offers on the place, and he just ran a beautiful practice. And so when I met him, I kind of came late to the party. He flew me out to Utah, had me meet someone named Gordon Christensen, who Art's met before. He's like the father of modern day dentistry. And I was wondering why Gordon was quizzing me so much. And I just happened to know the answers. And so me and Rich, we ended up partnering up on it. He sold me the practice. I've taken over. 7 years fast forward, I had 6 team members. Now we moved down the street across from Ames College, and I have 30 team members, multiple doctors. We do pretty much every specialty out of one place. And we've been blessed to be put in a position where we actually get to teach other dentists. So I don't teach at the dental school, but licensed dentists will come fly in. We'll train them on live patients. So then we have patients who are part of the Greeley community who can't otherwise maybe afford certain procedures, and we'll do different procedures like wisdom teeth, implants, bone grafting, you name it, kind of from every procedure we do and we teach to licensed dentists all over the country, some Canadians, some from other countries as well. And what I want to talk about today is just overall oral health and what hygiene matters. And if you look at the surface area of the gum tissue in the mouth and lay it out on your arm, it kind of covers the circumference of your forearm. So it's a lot of area in the mouth that is actually covered with the gum tissue. And so if we look at the British Medical Journal of 2016, periodontal disease has a significant relationship with cardiovascular disease. Essentially, at the end of the day, cardiovascular disease, stroke, hypertension, these things are caused by inflammation. It's multifactorial, but a large part of it is the degradation process of inflammation. And so if we look at periodontal disease in general, what it is it's a chronic irritant in the mouth creating swelling in the gum tissue that's chronically in place. And we have vasculature and vessels that run through the mouth at all times. And then obviously the vessels in the arms and the trunk and the body is much larger. The vasculature in the mouth is much smaller. But nonetheless, these bacteria get in from the mouth into the bloodstream and can affect you neurologically speaking, cardiovascular speaking. Every organ system is affected by these things. So if we look at heart attacks, heart attacks are the number one cause of death in the United States and in the world. And actually you should read not heart attacks, it should be cardiovascular disease, just in general, not heart attacks as its own separate category. Strokes are one of the leading causes of disability. And then cardiovascular disease is the number one health expenditure in the United States, and chronic inflammation is one of the main triggers. And if we've already established that one of the main triggers of inflammation in the body is coming from the mouth, and one of the main triggers for cardiovascular disease and stroke is coming from inflammation, the link in itself is just, in the literature. So top causes of death, recently I just Googled it and had to add COVID to the list, but you have to say a version of COVID and then the byproducts of, maybe pneumonia or different things as associated with it. But this is just what Google pulls up here. But heart attack, cancer, stroke, Alzheimer's, diabetes, and the list goes on and on. There's accidental death. I think what you guys are doing here is great. Grip strength is a really good indicator of longevity as you get to certain ages as well. So it's just what you do for the overall wellness of your body. And then we look at the number one cause of cardiovascular disease is due to unresolved chronic inflammation. And I won't go through the whole definition of it, but overall there's 800,000 Americans that have heart attacks every year, 800,000 Americans that have strokes every year. And then there's also 800,000 Americans that die of cardiovascular disease every year. And then also cardiovascular disease will kill 10 times more women than breast cancer. And so another study through the American Heart Association and just publicized in the Journal of Circulation talks about blockages. I thought the interesting thing is what they do is they look at the blockages and then they'll go ahead and look at a sample inside of the clot or the clog in these arteries, and they find that there's 16 times more oral germs than a healthy person found in these clots. Now, this is bacteria that can only be derived in the mouth. So, my brother's an anesthesiologist. When they do, like surgery or whatnot, it's a sterile environment. The mouth and the GI system is not a sterile environment. So when we do our surgeries, we can't say it's sterile, it's just aseptic. So in general, when we're doing these procedures, or when they do research in histology and they look at the plaques, they're looking at the type of bacteria that's leading to clotting in these arteries, that's leading to the number one causes of disability and death in people. And so if we look at it from the perspective of 75% of those germs are from tooth infections and 35% come from periodontal disease, or the bacteria that cause periodontal disease. And so essentially, when they did it post-mortem, they found out 50% of those patients had an active oral condition that was not diagnosed. And so it's one of those things that's just very common. It's inside the mouth. Sometimes we think sore gums is normal. Sometimes we think bleeding gums is normal. Well, all of it, if you actually saw inflammation on your forearm every single day, you'd be like, okay, something's abnormal here. But we've just been taught from a societal perspective to understand that this is maybe something that's just present. So 50% of patients with cardiovascular disease have an active chronic oral condition, and chronic and active periodontal disease increases the risk of heart attack by at least 2 times and stroke by 3 times. And then just more literature in terms of COVID and a 7.6 times increase in hospitalizations. You have a 4.5 times increase in being on a ventilator. I think from a COVID perspective, maybe some of these stats might remain in the past, but either way, we know if you were on a ventilator, the chances of coming off the ventilator were significantly reduced. So from that perspective, if we take good care of ourselves from an oral perspective, obviously the body is connected to the mouth. So from an overall perspective, the risk of some of these pathogens and viral infections is far, far less. And then so diabetes as a whole, if I'm clearing someone for surgery and they have uncontrolled diabetes, their A1C needs to be below an 8.0 for us to do surgery with them. Obviously, we want your A1C even lower than that. But from the perspective of postoperative infections and overall perio disease and cardiovascular disease, the link between diabetes and that is still present as well. And then Alzheimer's. I thought this was really interesting. Just in general, when they did checks on patients who were post-mortem with Alzheimer's, they looked at the types of bacteria. I got a really cool slide showing the spirochetes that are present in the mouth. And essentially, they just look like corkscrews, and they corkscrew in through the vessel, they get into the bloodstream, and then they go everywhere. So when they looked at the plaques in people's brains, they found spirochetes in the brains of patients with Alzheimer's. They also found that 93.7% of brains affected did have the spirochetes present as well. One thing we're also doing in the practice that I'm not necessarily speaking about from a perspective of this conversation is we are looking and testing patients for sleep apnea and just checking your oxygenation levels. There's just testing you can take home with you. So we have a simple ring that can go on a finger. You get 3 night studies in a row, gives us a lot of data. And then if there's any risk factors on that, then we have the official home sleep test you can take as well. There's a lot of new research coming out saying, and of course the CPAP is a very good option, but a lot of patients can't tolerate a CPAP. And then are we going to talk about surgical interventions? Well, if we have a surgical intervention, they have the Inspire. They have what's called a BSSO surgery where they physically move the maxilla and mandible forward. They have the UPPP where they can go out and clear out the tissue in the back of the mouth. But a lot of the literature is showing that if we can approach this in a non-surgical way, it's always the first modality that we want to maybe speak about. So for children, when we do expansion, we evaluate them from an orthodontic perspective. If you expand the roof of the mouth is also the floor of the nose. So the major obstructive area with sleep apnea is back here in the throat. So imagine it as just 2 tubes, right? One from the nose meets up into the mouth, one from the mouth meets up and goes into the trachea, into the lungs. So 2 tubes create 1 tube, goes into the lungs. The main obstruction is right here in the throat when it's obstructive sleep apnea. So if the tongue and everything is draping back into the airway at night when you're subconsciously, not protecting your airway and you're going through different sleep cycles, you're not breathing appropriately. So with the kiddos, when we catch them when they're young and we expand the upper arch, when you expand the roof of the mouth, you expand the floor of the nose. So when you can breathe through your nose, A, you shrink the adenoids and tonsils versus your mouth breathers. So then you got kids seeing the ENTs for adenoids and tonsils. B, what you're doing is you're increasing the oxygenation and the amount of nitric oxide getting formed through the sinuses. So when you breathe through your nose, nitric oxide is formed in the sinuses and it can vasodilate the lungs, which allows, if you picture the alveoli in your lungs as like, a bunch of grapes, it increases the amount of air that can be taken into the body. And then 3, when you expand the roof of the mouth, you create more space for the tongue to get suctioned up to the roof of the mouth and get out of the airway. So there's something called myofunctional therapy. It's basically physical therapy for the, muscles in the mouth. It's a whole program we can put people through. So it gets the tongue up and out of the way. And then there's different lasers you can use, like dermatologists will use these lasers on the skin. It adds collagen into the tissue, tenses up the tissue. So you can use the same laser on the soft palate and inside the nose. And it can also tense up those tissues and get them up and out of your airway. So there's a lot of different adjuncts and things we can do. The reason I bring all of that up is because we're talking about Alzheimer's. If you're breathing more appropriately, you have a decreased chance of developing Alzheimer's, because one of the leading contributing factors to neurologic degradation is inadequate oxygen on a consistent basis. And so pivoting back into perio, the pathogens that are transmitted from person to person. So if you have a really healthy mouth, but your spouse has an unhealthy mouth, and then you guys kiss or you guys share a spoon or whatever happens, they are transmitting those pathogens to you. We've had patients go off, and I've treated them for years, and they go off to college and they come back with a mouthful of decay and they're just kissing the wrong boys. And so it's just a version of that can exist as well. And then also, when babies are born, they don't have all those negative bacteria in their mouths. Yeah, and who hasn't got to college and kissed the wrong person before? So then you have your kiddo, and then the kiddos don't have bacteria in their mouths when they're born, but then we pass that on to our kids by sharing the spoon and kissing our kids and doing all of those things. So from that perspective, there's a version where patients come in and they talk about, oh yeah, my whole family has had bad teeth forever and ever and ever, and all the generations. Well, it's not a genetic component per se. The major reason why is since this bacteria is passed on, and it's the oral microbiome. So a lot of research is coming out with the GI and the health of the GI, and like serotonin and dopamine uptake and all these things you can do from a healthy GI system. Well, the mouth is connected to the entire system. And so keeping the microflora in the mouth healthy is allowing the aggressive bacteria to not propagate, because we're always going to have bacteria in our mouths. We're always going to have fungus in our mouths. It's just keeping that bacterial count under control where it's a healthy system or ecosystem that occurs. So here is the microscope. So we have a microscope in the practice. It hooks up right to the TV. Tara is actually one of our awesome hygienists. So appreciate you coming out. So she would be the one who's absolutely qualified to take a sample from underneath the tissue. You don't even get numb for it. You just take a little curette right under the gums, a little bit of plaque, and we put it right up on the slide. And we get to see in real time. It takes about 8 minutes or so to prepare the slide. And we just see in real time what's underneath the tissue. What I'll do is I'll show you the spirochete video, and I'll just kind of pass it around here. So if you want...
This is what you're seeing on the slide.
This is what you'll see on the slide. So there are a bunch of corkscrews, and they are just going crazy.
Pass it back first.
So all of these bacterias are in your mouth. And so there's different types, and some are more aggressive than others. But when they're active, they are very, very aggressive. And they will cause inflammation. They will cause chronic inflammation. And now, outside of just the inflammatory process just in general, when you have chronic inflammation, you're going to lose bone. When you lose bone, you have loose teeth. When you have loose teeth, then you need to see us. Or there's a version of there's decay, and then you have a cavity, and then you have that cavity turn into a root canal, and then that root canal turn into extracted tooth, and so on and so forth. So if we can get in here from a prevention perspective, when you can get in. Yeah, Tara lives in this world. Oh, Art? Yeah, I'll pass it off to Art here. Okay.
Oh, I saw it.
Oh, you already saw it? Okay, good. All right. So when it comes to, I can tell you all the scary stuff, right? But how do we actually fix it? And how do we do it in a way that's preventative multiple times per year so you can see Tara, who's way nicer than I am, versus having to see me on the surgical side? And so there's multiple modalities here. So there's ozone water, and the ozone is just an O3 molecule, so oxygen, O2, and then you have a third molecule that's put in, sometimes this creates naturally in the world, and we also have generators that can create it in the practice itself. We're currently implementing this into the business as we speak. But essentially what ozone is going to do is going to kill virus particles, bacteria particles. We found out about it a lot during COVID, where they could aerosolize it and have ozone gases. You can drop ozone into a liquid and inject it into tonsils and shrink the size of tonsils without any anesthetic. The patient's not going to feel anything at all. You can use it and rinse out certain sites. You can use it to clean out your lines. That's a naturally just occurring thing. We got all the lasers. So we have diode lasers. We have the lasers we talked about for the soft palate and in the nose. There's different lasers that can do surgery. There's different lasers that can cut bone. There's different lasers that can cut soft tissue. And there's different lasers that can reduce bacterial counts. And so as the lasers go inside the sulcus of the tissue in between, if this is the tooth and this is your gums, you got the space in between, the laser can bring a photobiomodulation of a certain wavelength of laser that gets deep into the tissue in an area where bacteria grow, where oxygen can't get to, where sometimes instrumentation can't get to. And also from a surgical perspective, we would have to get a scalpel and physically go in surgically and go clean it. Now these lasers can reach places that the scalpels don't need to go. So it's a very atraumatic or less invasive approach to it. And I've had the team try it on me without anesthetic. It's a little uncomfortable, but they have a lot of gels and ointments and different things that they can apply to the tissue without a needle to then use the laser to get and clean the areas. Bleach. I'm going to say this one with an absolute disclaimer on it. Bleach kills everything that's alive. It kills all vital, organic, and inorganic stuff. So when I say bleach, there's a parts per million you got to break it down to and dilute it to. Do it at your own risk. But if you follow a teaspoon and 8 ounces of water, I'll show you a study that kind of talks about bleach and how it can kill organisms. We also use it in endodontic or root canal treatments, and it kills bacteria as well. PerioProtect is something we can create for you. It's just a product. It's like calling a tissue a Kleenex, but essentially we make a custom tray that fits your teeth. It's a custom gel. It's a, hydrogen peroxide type of gel that goes inside the trays, and you wear it all night long. So some patients who are going through cancer treatments, some patients who are going through, like autoimmune issues or, lupus, or they have different medications that will cause a lot of decay or issues to occur. We make certain trays for them to help against decay or help against acid reflux or help against excessive bacteria that cause periodontal disease. So PeriProtect is a good adjunct. The next thing is surgery. We always like to keep surgery as a last resort. We like to try different things in the practice to get your body to heal in the way it needs to heal. And of course, surgery is a modality that we can use to go and clean and repair certain sites and rebuild sites as well. And then we're just trying to kill germs at the end of the day. Yes?
Is high alkaline water the same as ozone? Or?
Different. So high alkaline water, and again, I don't want to speak and maybe speak incorrectly, so I would say just this is my 2 cents on it. I don't know where I'm going to go with it, but I'll just kind of start. I think the alkaline water component is there's a pH in the mouth that sometimes can come through acid reflux or just generalized pH from when we eat certain foods and they get metabolized by bacteria and they create acid in the mouth, and then that degrades the teeth further. And then the alkaline nature of the water is going to be more basic than the acidic nature, and then it kind of balances the pH in the mouth. So that's what I think that's going to do. But ozone in itself is just a third oxygen molecule getting jammed into 2 oxygens, and an oxidative reaction is going to occur when you implement it or use it in certain areas, and it's going to be able to lyse bacteria cells. It'll be able to kill viral cells, and I'll kind of go over like the aspect of how it does that. So, it happens naturally in the world. Lightning passing through the air will create ozone. Oxygen in the presence of a certain wavelength of UV light will create ozone. So it's just naturally occurring. And then they actually have, very inexpensively these days, ozone generators where you can create this on your own. And essentially it just generates it in your office. When you do that, you can keep it for a half a day. And then by that time, it kind of, will dissipate and lose its efficacy. So then you remake it at lunch. So it's antimicrobial by killing bacteria, fungi, viruses, yeast, and prions. Prions are, the thing that causes like mad cow disease. It's not as common, but it's just something that it still works on nonetheless. It's anti-inflammatory by reducing swelling and redness or erythema. It stimulates healing by bringing oxygen to the area, just almost like a hyperbaric oxygen type of treatment. And it enhances the immune system mediators. And so this is just kind of COVID literature. You close down the practice for X amount of months or you're forced to. All I do is read literature and ways on how to solve these problems. So we have all these toys that exist now post-COVID, but essentially it's just been proven to kill viral particles. And it can take care of bacteria, it can take care of viruses, it can take care of molds and fungi. And what we use it for is we'll run it through our lines, or in the process of getting the implementation for it to run through the lines and go and disinfect the areas to decrease all of these bacteria and viruses. So ozone will react with the proteins in the cell membrane and receptors on viruses. And then through oxidation, because of the extra oxygen molecule, it'll go and destroy the DNA and RNA in whatever virus that's there. And then when it comes into contact with bacteria, there's the cell wall, and it can create lysis in the cell wall when you're using it specifically with bacteria. And then oxygen, so there's anaerobic and aerobic bacterias. The anaerobic bacterias, specifically in the mouth, I can't speak for in general with the whole body, but anaerobic bacterias in the mouth are usually the most aggressive ones. And when we find those, when our hygienists are measuring our gums, they're going 323, 4.4. When they get to the 6s, we start to get into anaerobic territory, because 6 millimeters down, oxygen can't get into the sulcus of the tissue and get 6 millimeters down. So from that perspective, we start to see a fast degradation of the bone and the tissue. And so when we use ozone and laser therapies and things like that, it can permeate deeper. It brings those oxygen molecules deeper, and it can also kill those more aggressive bacteria. And so how to make ozone, if you were ever interested in doing it, there's lots of YouTube in the DIY world out there. You can give it a try. You can run it through different oils, and you get like this, I can't remember the exact name, but ozonated oil that they can inject into tonsils. There's so many different ways you can make it into gases. There's a little bit of a smell to it. We were kind of gassing the rooms with it during COVID. We tried hypochlorous acid, misting in the offices. We found it corroded some parts, but we just tried a whole lot of different things when it was coming to killing bacteria and viruses. And then here's your bleach part. So again, 0.2% sodium hypochlorite is going to be bleach. When you go and buy your Clorox, it can't have a fragrance to it or a scent to it. It has to be the good old-fashioned, just regular bleach. A teaspoon and 8 ounces of water is typically what you can do, and you can even add that into a water pick and use it underneath prosthetics or around natural teeth or bridges. It decreases bacterial counts in the mouth. If you get the dosaging or the mixing wrong, err on the side of more water, of course. More is not better, okay? And then obviously rinse and spit it out. Don't swallow it, please. Okay. So the conclusion of the entire study was that 0.2 sodium hypochlorite mouthwash is as effective as a 0.2 chlorhexidine treatment. So typically speaking, in dentistry, we're using chlorhexidine, or it's called Paradex. Comes in those blue or brown bottles. We were using it a lot. What we find is that it inhibits fibroblast formation, which means that soft tissue can't grow as well when you're using Paradex. But it was the best thing we had in the moments that we had it. It's also used for surgical scrubs. When you scrub your hands pre-surgically, they have a different percentage, but you get it under your nails. Some of the Paradex I keep for my dogs and my kids, so when they get cut, I'll just get it on a rag and I'll rub the cut. But now we have things like Closis. So if you can even buy Closis over the counter, there's like Walgreens or anyone with a dental aisle. Closis, and it's spelled Closys, is hypochlorous acid in a mouth rinse solution that's made specifically for oral hygiene, and it works really, really well. So even in surgeries now, instead of using chlorhexidine, I'm rinsing surgical sites out with Closis. And it's a product we believe in more now. But this study was done back when we were doing chlorhexidine scrubs and all of those rinses, and the sodium alpha-chlorite and chlorhexidine, they showed similar efficacy, and then the bleach is a little bit more readily obtainable. So lasers, they are, and how am I doing on time, by the way? Still okay? Yeah? Okay. I got like 5, I think. So they are effective in killing bacteria that cause inflammation. They penetrate the epithelial, so like the outer tissue layers, and they kill deep and hard to reach areas. Also, based on the settings, they have different wavelength settings you can remove tissue with it, or you don't activate the tip and you just bring in a different wavelength with no cutting, and it just is photobiomodulation of the tissue in the area that decreases bacterial count in a non-invasive way. And you guys are doing it after all your SRPs. We're doing it on follow-ups. So not all like electricians are created equally. Not all dentists are created equally. Not all physicians and medical professionals in any profession are created equally. It's sometimes the disposal of the resources and the training that the hygienists have in a specific practice that allows us to maintain it in a different way. So yes, sometimes getting your teeth cleaned is good, and keeping things like that feel is nice, but it's also kind of what's a little bit deeper. If you dig a little bit deeper into what's happening in the practice, it's sometimes a little bit more effective to have some of the toys. So the hygiene team at the practice is really well trained. I mean, they make my job very, very easy when it comes to maintenance of all our patients. We do a lot of reconstructive procedures, and we have special protocols with glycine powders and different things that can get deep down and decrease the biofilm layers. And it can be used in dental surgeries. So there's different lasers, like I was saying before, that we can use to cut bone, cut soft tissue. The photobiomodulation, you can use it extraorally for muscle pain. There's just a lot of different adjuncts that these things can do. And then on the soft palate and inside the nose to open up airway. The Perio Protect, it's 1.7% hydrogen peroxide. So hydrogen peroxide is your H2O2. So it's that extra oxygen radical again. So H2O is just H2O is water. And then you add an extra oxygen on there, you have hydrogen peroxide. You saturate the teeth in that all night long, not necessarily for the teeth, but for the periodontal ligaments and that whole area, and it'll decrease bacterial count in those areas. And so you hypersaturate your teeth in that all night long. Also, the tip up here about, or maybe it's on the next slide, about using baking soda. That's also for the alkaline component. So you can just dip a wet brush in baking powder, brush the teeth with it, and then put the Perio Protect trays on, and you're hypersaturating your teeth in an alkaline area where it's decreasing the acidity in the mouth as well. So there's a lot of different tips and tricks you can do from home. Smoking, not good for you really in any way, but from a periodontal perspective, if you smoke, you have a 3 times more likelihood to have periodontal disease. Vaping, I think, is actually worse than smoking, personally speaking, but 2 times more likelihood to have periodontal disease. And then obviously we talked about the contagious nature of the bacteria. This is more for the docs and things when we do lectures, but it's just kind of, lining up the type of bacteria with the antibiotic regimen that's associated with it. It's a very general type of thing. For whatever reason, if you're prescribed something outside of what this says here, it doesn't mean that it's wrong. It just means there's other things going in play that they're giving you a different antibiotic for. Fluoridated water. The dentists who got this thing passed back when they had to get all the legislation done to actually have fluoride put in the water. I know it's sometimes a divisive topic with the pineal gland and things like that, but they talked about it being, one of the 10 greatest public health achievements in the 20th century. So fluoridated water will decrease decay by 25%. if we're just speaking just with one topic, just decreasing decay in the mouth. Now, how it affects people systemically, there's a lot of debate in the world on that one right now. And I think time will tell. Literature-wise, we do improve things over time. What I can say is about the fluoride varnish, I still believe strongly in the varnish. And the reason why I believe in the varnish is it absorbs into the teeth and it has a sticky nature to it, and you're not systemically ingesting these things. And so then it kind of counteracts some people's concerns with chronic ingesting of fluoride into the systemic system, but we're just applying it to the area that needs it. Also, there's studies by Gordon Christensen who he said when the little ones come in and you paint the fluoride varnish on their baby teeth, it absorbs in to the point where when the natural teeth come out, the grooves in there have less deep grooves. And so Gordon Christensen was not ever paid by any company to run a study. He's completely independent. Him and his wife, Rella, do a whole lot of research. And so this is coming from Gordon's research. But what they showed is the grooves in the adult teeth come out with less deep grooves. So if you look at it under a microscope, it looks like the Grand Canyon. And then when you have fluoride varnish applied on the little kids, then the grooves aren't as deep, which doesn't predispose them to cavities later down the road. So we all know, I like Sour Patch Kids growing up. And I have a crown up here. I got amalgam fillings everywhere. I got cavities after my braces. I actually ended up working for my orthodontist. And he was like, you were one of my worst patients. I was in braces forever. So through many years of non-compliance, and then also being in the dental industry since I was like 17 years old, fast forwarding to now, a lot of these things that we're hearing just hold true. And so if we can be preventative in nature, and if we can prevent the first filling from occurring, but we all know in 7 to 10 years, the filling will fail and it'll be a larger filling. And then in 7 to 10 years, that'll be a crown. And then maybe in another 10 years, that'll be a root canal. And then in another 15 years, that'll be an implant or what have you. And maybe the timeline is much shorter. So if we can be preventative in that nature, and plus people are living longer, the mileage you guys need on all of the body parts, including the mouth, just need to go longer. And then there's also glass ionomer cements and different things we can use that can release fluoride from certain like fillings and restorations and crowns we do. So a couple of things you can do is you can load up a toothbrush with fluoridated toothpaste. In this situation, what we recommend, and this is just more for at-risk patients, that you brush with it, but you don't spit, or excuse me, you spit, but you don't like rinse your mouth out, and then you pop in one of these trays. So you hypersaturate your teeth in this stuff all night long. So it's our protocol for some patients who are going through like cancer treatments and other stuff. And then I kind of covered the baking soda trick already. And then here's just a picture of a tooth before and after the sealants. Our hygienist can apply sealants to the kiddos' teeth. My wife's a dentist. She just has sealants in her teeth. I replace her sealants every 3 to 4 years, right? She just doesn't really have cavities. She has really good home care, but sealants will eventually pop out just through wear and tear. For me, I got all those fillings. I'm not a candidate for sealants. I got to take a little bit better care of my stuff. But sealants are a really good adjunct to prevent dental treatment. So one thing I want to say about Greeley, and Art's been, really supportive over the years, and we've had a lot of great patients support us over the years. But Greeley was the only place, I've hopped over all over the country. Greeley's been the only place where the patients actually said, welcome to Greeley, when I took over for Dr. Boyes. And so this community has really supported us in terms of where I started to where we are now. And sincerely, we're in a position where we're here to give back. And so if you guys do ever need anything, you have any questions when it comes to dentistry, please feel free to stop by, and I'm more than happy to help. Thank you.
Thank you.
Thanks.